Okay. You are dispatched to the intersection of Main and Vine Streets for a pedestrian hit and run. You arrive to find a 22-year-old man lying supine on the ground and not moving. Witnesses state that the victim was trying to cross the intersection and walked out in front of a car that ran a red light and kept going. Law enforcement and the engine company are also on scene to assist with scene safety.
Okay, have my proper PPE is the scene safe?
Yes.
Okay, mechanism of injury is going to be vehicle versus pedestrian. I see one patient. Do I have any more?
Just one.
Okay, I'm going to call for ALS and I am going to apply the cervical collar for spine stabilization.
Sure.
My general impression is that it was vehicle versus pedestrian, 22-year-old male on the ground, supine. Chief complaint, what is your, are they responsive, conscious?
Yes. Responsive and answers questions.
Okay, chief complaint.
Severe left leg, hip, and back pain.
Okay. Now I'm going to do my ABCs. I'm going to assess the airway. I'm assuming they're responsive and talking to me that it's open.
Open.
Okay. Going to listen to lung sounds.
Lung sounds are clear.
Look for chest rise and fall. How's that?
Equal rise and fall.
Okay, SpO2.
94%.
Okay. I'm going to check for radial pulse.
Rapid.
Okay, is there any other bleeding?
No major bleeding.
Okay, the skin color, temperature and condition.
Cool, pale, and dry.
Okay. I'm also going to position the patient and cover them up to prevent any signs of shock or further shock. Now I'm going to get my vital. Nope, I am going to transport. This patient is a priority. And we're going to transfer this patient immediately. Now I'm going to get my vitals. Can I take your blood pressure?
Yeah.
Number 72.
106/76.
Respirations are 60, or no, sorry, pulse is 60, respirations are 16.
Pulse is 112 beats. Respirations are 18.
Okay. I am going to then do my head to toe assessment. I'm going to palpate the scalp. I should probably be on this side. I'm going to palpate the scalp. I'm going to look in the pupils, both sides, flashlight. I'm going to check for leakage in the ears, the nose, the mouth. I am going to look for JVD, also tracheal deviation. I'm going to go to the back and check the cervical spine. I'm going to look, listen, feel the chest. Palpate the chest. Watch for symmetrical rising and falling. Listen again. Okay, I'm going to palpate the abdomen for any tenderness. Is this, we okay so far?
No, noted.
Okay, I'm going to check the pelvis. You said left hip.
Yep, unstable left hip.
Okay, I'm going to check the genitalia. I'm also going to do my lower extremities. Okay, I'm going to look for dry pulses in these.
Yep.
Okay, can you wiggle your toes for me? Okay, can you feel this when I squeeze them?
Yep.
Both sides?
Yes.
Okay. Do this thing on the top. Check for a pulse. Can you wiggle your fingers? Which finger am I squeezing?
Thank you.
Okay. And we have pulses in these as well.
Yes.
Can you feel that one? Which one?
And
Ring finger?
Yeah.
Can you wiggle your fingers? Okay. And then when I transport the patient, when I move the patient onto the stretcher, I'm going to check the back, the buttocks. So I got head to toe. Next, I am going to address the secondary injuries. So her left tibia, fibula, the hip. I'm going to splint them or bandage them as time allows. I'm going to reassess this patient every 5 minutes during transport. I'm also going to get my sample history. Signs and symptoms.
No signs seen.
Okay. Allergies.
None.
Medications.
None.
Past pertinent history.
None.
Last oral intake.
Lunch 15 minutes ago.
Okay. And events leading up to.
Walked in front of the vehicle.